Hi, everybody. I'm Christine Bechtel. I'm a consultant and advisor on patient and family engagement to quality insights. And I'm going to talk to you today about an innovative pilot project that we did in South Louisiana to improve hand hygiene. I'm going to talk to you about a terrific project that we did. It was focused, as I said, in the long-term acute care hospital setting, but it really applies to any setting in healthcare. And I'm going to give you enough detail so that you can think about whether you might like to implement this kind of a project in your institution, regardless of the setting of healthcare that you're in. So I'm going to start first with a focus on this concept of patient and family engagement. A lot of people talk about this today. I think it ends up being something that we think we know what people are saying, but we don't really know what they're saying because it's kind of like a Rorschach test. It means different things to different people. So what I'm going to show you on the screen here is really the leading modern definition established by researchers for patient and family engagement. And it's really focused on this idea of patients, families, and their representatives working in an active partnership. That's a really important concept, an active partnership at various levels across the healthcare system, which I'm going to talk about in a minute, to do two things: improve health and to improve health care. So I mentioned engagement happens at different levels, and it's really focused on partnership. So the first level is direct care, and this is what most people think of when they think of patient and family engagement. The more modern approach to engaging in care is how we expand patients' capacity to get well. So it's a partnership-based approach. It's decidedly different from getting patients to take responsibility or getting them to be good patients or trying to get them to do what we think they should do. This is a little bit of a different frame on that. The second level is system design and governance, and that's focused on the idea that patients, families, and consumer representatives are really guiding the change and ongoing operations, particularly of a healthcare facility. We're going to talk a little bit more about that. And then the third is policy making. If we think about healthcare as a policy-driven economy, then it follows that we want patients and families actually engaged in shaping the policies that have such a tremendous impact on our healthcare system today. But this project was really focused on this second level, how we're going to engage patients and families in creating a project together that we think will work. And it also relates to engaging them in their own care by figuring out ways to help them clean their hands more often. Patient and family engagement is not just the right thing to do. It's really a proven strategy in quality improvement. There's a robust evidence base behind it, and that evidence base continues to emerge every single day. And we're seeing more and more providers producing results, often producing them much faster when we do things with patients instead of for them. And when we do that, a couple things happen. First of all, we tend to see that providers get it right the first time. So instead of guessing at what might work, we're actually co-creating what will work together. The second thing we see is developing innovations based on ideas that might not have otherwise come to us as healthcare providers who work in the facility day in and day out. And we often learn things we didn't know, see things we might not have seen before by understanding through patients' eyes. Blending that with provider experience and expertise is a really powerful combination. So how does this apply to hand hygiene and particularly long-term acute care hospitals? That was the focus of our innovation project. So here we are trying to get patients to do something that we want them to do, aka wash their hands, or sometimes ask the staff, hey, have you washed your hands lately? But we're really guessing at the most effective methods. So we turned this idea on its head, and we decided to create an intervention using their voices really as fuel for change. Now, this can be tricky in LTACH. We know that because, like many healthcare providers and clinicians, the staff are overworked, patients are vulnerable and complex. So you may or may not have a patient advisory council you can draw on, but certainly the level of complexity for many patients in this particular setting doesn't lend itself to sitting on a patient advisory council or through, long focus groups. So we borrowed from some existing work that was done by Qualis Health around hand hygiene. We piloted it in one facility, and that facility was AMG in Houma, Louisiana. Our terrific project lead on the ground was April Yusi. She, at the time, was the director of quality and infection control, and we had great support from leadership, both the CEO and the chief clinical officer, who were aware of the project and really understood that this would take a little bit of time and resources to implement, although it wasn't a big heavy lift, but it was really helpful to have their support and involvement. So here's what we did in a nutshell. We started by figuring out what's happening in this particular facility. What are they doing to promote hand hygiene with patients? And we've helped them catalog and figure out what are they doing, what are their existing workflows, what materials are they using to promote hand hygiene with patients. And then we partnered with patients by doing a series of interviews. Not a big heavy lift, not super time intensive, not something that a researcher has to design a perfect protocol for. We just talked to people to figure out what did they remember about the education process, what was effective about the education materials, and then we selected some interventions based on what patients told us might work for them and what the staff thought would work in their own workflow and processes. And we designed a survey that would assess the impact of the interventions that were put into play. So that's a high-level snapshot of what we did. So a couple key things. One, around patient interviews. We kept it very simple. As I said, this is not a intensive process here. We just want to figure out how do we do enough interviews to start to hear key themes from patients that will repeat over time, and then we know we're kind of onto something when we start hearing the same thing from multiple patients. So we focused on doing a small number of interviews with patients who were functionally able to communicate, and we asked the same basic set of questions to each of the individuals and documented exactly what they said. So here's what we found from those interviews. First of all, no one remembered being talked to on admission about hand hygiene. It was a process that it was kind of part of the initial introduction to what's going to happen in this facility in the admission process, and it was just getting lost in all of the other information that was being communicated. The second thing we heard was that hand washing and hand cleaning supplies were convenient, but they had a lot of ideas for how to make them even more convenient. They said things like, well, gee, if you put hand sanitizer on my tray when you bring food in, that would be a great help. We also heard that no one was comfortable asking staff if they'd washed their hands. And they said things like, you know what, I really need to be a patient here, not a police officer. I would be very uncomfortable asking the staff. And so, we trust that because frankly, if they're not comfortable, they're not going to do it. So we decided not to rely on that strategy. And then finally, patients said, yeah, I know how to clean my hands. I mean, it seems pretty straightforward. Although when our project lead, demonstrated, okay, well, let me show you, they learned a lot more. So while they might say, yes, I feel comfortable and confident, once they were actually shown how it worked, then it really did improve their knowledge even more. So the facility decided on a couple of interventions. They tried an admission checklist and an education packet, and they got mixed results for the reasons I mentioned earlier. They just tried to change the way the information was delivered, but we realized later it was still the moment in time was really the problem and not the information delivery. They created some opportunities to discuss and demonstrate improved hand hygiene techniques, increased the availability of hand hygiene products. They increased signage. This is a good, helpful way to remind both patients, but also families and visitors about the importance of washing their hands. And then, of course, they did some staff training as well on using things like the World Health Organization videos. And then they also asked the staff to advise on what, here's what the patients recommended, what do you think? And that was also helpful because if it's not realistic for the staff, then it's not going to happen. So we have to have that balance between what patients say would be helpful and what staff feel is doable. And then finally, we designed a simple 3-question survey that every patient could take at discharge so that we were really learning whether or not these interventions were having an impact. The 3 questions are very simple. You can see them on your screen. It was just, did staff talk to you about washing your hands? Did you notice staff washing their hands, and how easy was it for you to wash your hands? You guys can do any number of questions here. I think the key is just keep it simple and make sure there's a connection between the questions you're asking and the interventions you deployed so that you can get some information about whether or not it's working. So their results, were pretty good. We didn't do any baseline data collection, so that's another lesson learned. But they were pretty good and getting better. So you can see the first measurement here. So a couple lessons learned that I'll leave you with. One is patients have really important insights and ideas. Often when we ask them their experiences, like the light bulb went on for us. Oh, of course it's not as easy as we thought, and here's why. So it's good to ask and never assume. That's an important lesson. As I mentioned earlier, leadership support was very helpful because sometimes patient ideas require resources like buying more hand sanitizing. So it's helpful to have leadership support. Setting baseline data, helpful. So ideally what we would have done is to have a 3-question pre-survey and then a 3-question, same 3-question post-survey. And so we recommend that for those of you who are going to try this project. We also realize that our surveys and the education materials need to talk about cleaning their hands, not washing their hands, because washing hands to people means that there's a sink and water. And so we need to account for the idea that there might be hand sanitizer where it's really about cleaning your hands as opposed to, quote, washing them. As I mentioned also, we want to engage families and visitors in a similar process because their needs, perspectives, and experiences are very different. Always keeping an eye on whether the data collection you intend is actually happening. I think it's sort of one of those, when you start doing data collection, there are multiple parts of the organization that are involved. You sort of assume and hope that they're, moving according to plan. We found that that's not always the case. And data collection is such an important piece because if you really want to know if what you're doing is working, and if it's not working, you want to stop doing it because it's, time and resources, right? So getting it right and getting, easy ways to collect some data to get feedback on whether your plan is working well, that was really important here. We also realize you can't rely on sort of one person to do everything, or one event. So in other words, if you assign your infection control director to be the only person that talks to every single patient about hand hygiene, what happens if they get sick? What happens if, they get redirected on another project? So you've got to have a more systematic way of approaching your interventions. And it's got to be easy and convenient for patients to actually clean their hands. So we heard that a lot from patients. More hand sanitizer is better than less. Reminders are key in this process, but that applies to patients, but also to families, visitors, and staff. And then again, enlisting the staff so that we're really having this be a collaboration and a partnership. This isn't about having patients tell us what to do. That's not partnership, right? This is about how the staff and the patients come together. We can use patients' feedback and experiences, and we can use the feedback and experiences from staff to really create the ideal package of change action items that will really drive improvements in the facility. So here's a quick snapshot again of the process that I just described. So for those of you who want to implement something like this in your facility, here's what we recommend. So now it's your turn. We really would love it if you guys piloted this and report back to us on what you learned. We're here to help, and I hope you have a great and infection-free new year.